Hey, everybody. Welcome back to Shaman Talk with Tegan. Tarot with Tegan is where you will find me on Instagram and Facebook. I have another guest today. Her name is Nikki. Nikki, thank you for being here.
You are so welcome. Thank you for having me. I'm really excited.
Same. So go ahead. I will let you kind of introduce yourself and what it is that you do.
Sure. So, yes, my name is Nikki. I am a licensed clinical professional counselor. Most people think of that as just a mental health therapist, kind of layman's terms. I work in an office setting, so I see a lot of different populations, a lot of different mental health concerns. And yeah, I see pretty much as young as 3 years old and up. I have a lot of my work focused in on trauma. So I have my trauma focused counseling certification. So a lot of my modalities within therapy are from a trauma based lens.
Okay, awesome. That's very interesting. So let's kind of just start a little bit at the beginning of were you always kind of interested in working in this field? Was it something that just kind of came up randomly? Like, how did that go about a little bit?
Sure, yeah. So I knew I wanted to get into this field pretty early on in my life, probably around 12. I think I
Oh,
had
wow.
kind of had that as a dream. I had my own trauma and counseling when I was about 6 years old, is when I first started.
Okay.
And then I had another counseling experience after that when I was around 12, 14, and then have been in therapy myself on and off since then. So I can very vividly remember like my first social worker's name and how impactful it was for me, even at 6 years old. So that is what led me to want to do this type of work too. It was like, wow, like this is incredibly healing, and I want to be able to help people in the same way that I was helped too.
So first of all, I think that that is amazing, and that's great that you felt so impacted by a person, because that's the thing is we never know the kind of impact we're making in somebody's life, right? So that's awesome that you
Right.
kind of went for that goal and you have achieved it, and you're working in the thing that you want to be doing, and I'm sure that you are just helping so many people. Do you feel like
Yeah.
um you said you see people as young as 3. Do you see that often, or is that, rare? That just, stuck with me.
Yeah, no, that's a great question. I don't see too many that young. I would say in my years of doing it, it's probably been a handful as young
Okay.
as 3. But 4 and 5 is a pretty big population that I've worked
Wow.
with. And yes, it's also really hard, I think, to find therapists that will see that young as well. So I know that that is also why I wanted to do it, is because, I know with my trauma background and experience that, you know, anyone, no matter what age you are, even if, you're a child or sometimes even in the womb, like you can experience trauma too. And even if you don't recognize it, that is stored in the body. So I've wanted to work with as young as I can. I tend not to work with anyone less than
Mhm.
3, and I only know one other person that'll see like a 2 year old and like a baby, but just because of the type of work we do, I think it's a lot harder to um just with techniques and things work with anyone younger than 3.
Sure. Yeah, wow. Well, good for you for doing that. That's amazing, and I think, like, I always hear, like, "Oh, kids are so, like, resilient and blah, blah, blah," which is true, but then it's also like, okay, but then everyone has this, like, childhood trauma that we're all carrying around and trying to release, so
Yes.
it is great that some people are out there
Yes.
doing what you do in that way.
Absolutely. Absolutely. Yeah, I think kids are amazingly resilient. That is for sure. But I also think that a lot of times we underestimate, how impactful an experience can be for a child, positively or
Mhm.
negatively, and how they deal with those emotions or messages, whether they were directly or indirectly given to them, like how they hold that and how that shifts their perspective, their view of, the world and how they interact with others. So,
Yes, and that subconscious level is just, like, so hard to get to, right? No matter who you are, no matter how old you are, and then you first have to almost, like, at least just from my experience, you almost have to dig in there sometimes and really bring it forward to be like, "Okay, what is really fully going on and
absolutely.
why?" And things like that.
Absolutely. Yes. Yeah, because I think our natural defense mechanism or coping skill is to just block it out, avoid, and then of course it comes out then in other ways, and it takes time to, kind of dig up those, yeah, those barriers that we've kind of put in place to protect ourselves.
Yes. So when I was kind of talking to you a little before this, you mentioned that you also do somatic therapy, and
I
okay,
do.
so I had
Yeah.
to look that up because I had no idea what that was. So can you just talk on that a little bit and what it does and who it helps?
Yeah, absolutely. Yeah, so somatic therapy is basically kind of trying to heal, different, I guess, struggles and concerns that you have by focusing in on the body and trying to, I guess, relieve, whatever symptoms are coming up naturally by working with the body. So a lot of it is like attunement and recognizing different things that come up for you in your body, which I think most of us, at least for me, I never learned to do that. That's not something that a lot of us have been
Mhm.
taught. Even just breathing, like there are specific ways of breathing correctly in the way that we should, and conscious breathing to relieve some symptoms that are stored within our bodies, and none of us were taught that. So that's another reason why I ended up doing some somatic therapy work. Is, I mean, it started off with me
Okay.
personally, with some of my own trauma and even like medical conditions. I have endometriosis, which is in a very inflammatory disease, um, and a lot of managing that has been somatic
Okay.
work. So, when we go through things, a lot of us tend to kind of go inward and like restrict, to protect ourselves. And so somatic therapy allows us to, again, break open some of those barriers and heal from kind of within the body first. And then that helps our brain, because those are connected as well.
Yes. And so I find that fascinating and amazing that there are just it seems like lately in the past couple years at least from what I know, just these different techniques that are kind of coming into play besides either just talking or just being like here take these pills, it's like it's also all these other things that are slowly becoming more normalized. And it's interesting because you said
Absolutely.
like something about the body like no holds on to stuff, and like just from my perspective of the energy work perspective, the shamanic perspective, it is true, and like not just your physical body but your energetic body that everyone has like around them, that holds on to stuff too. So it's like
Yes,
my whole thing is I'm trying to
absolutely.
bridge this kind of gap of like healing the mind, healing the body, but also the spirit side of that as well. And I think that all those are distinctly connected. So, yes, of course, if you need to focus on your body first or your mind first, do it. But at some point, everyone would benefit from doing all three. What's your kind of general take on that?
Yeah, absolutely. I fully I in a are in am in agreement with you on that. I started energy work, I think, again, it was kind of a little bit of a mix between my own personal journey and my work with clients too. Um, and I started Reiki doing it for myself for a personal coping skill when I was starting to feel really burnt out
Mhm.
and bogged down by a lot of the, I think, energy that I have stored just in my work with
Okay.
clients, because especially with the trauma background, and how empathetic I am. Even if I try to implement a lot of the coping skills and boundaries and self care, sometimes it just, it sticks, in ways that, I don't even consciously, um, in ways I'm not consciously aware of.
Hmm.
So I think trying Reiki was like fundamentally a huge positive experience for me, that I was like, "Oh my gosh," like it felt like a massage, but for my soul.
Yeah.
That's how I describe it to other
Hmm.
people. It was like it just released so much, and I felt so much lighter and more clear-headed. So after that, I was like, I've got to bring this into, my therapy practice. So I got trained in Reiki. I'm certified in level 2,
Okay.
and have been doing that as well, as just as an additional modality to my therapy work. But I will say there is still a big gap. As much as I try to inform clients and give them, some, I guess, psychoeducation on, the mind, body, spirit
Hmm.
connection. A lot of people, I think, still very much view it as like taboo, and, something that is kind of like, hokey and doesn't really work. And, so really trying to help clients challenge, that avoidance or those negative, predispositions about it has been a challenge, but I think it's getting better. I'm seeing it more and more now that people are becoming more inclined to try it, and most of the time they have really good results.
That's amazing that like even you as an individual like you're making that impact of like hey, I'm like a professional, like I know what I'm talking about and but I still can include this different part of myself and help people with it. And just like anything kind of in the more energetic spiritual realm, like people don't have to do it or have to believe in it, but like you said, I think there's still this just kind of taboo or just preconceived notions of like, oh, that's not real or that's not going to help. And for me, it's always kind of like for certain people who maybe have chronic anxiety or chronic, it's like at this point, why wouldn't you try it? You know what I mean? Like you said, I've only seen
Absolutely.
people have positive results, and so just I think that's amazing that you can bring that in. And is there usually almost like in your mind, like a guideline of like, okay, I think this person could benefit from it? Do you usually tell everyone about it? How do you kind of go about that?
Yeah, that's a good question. I do, I guess, pick and choose when to discuss it with a client. I think I would say I offer it to most everybody. I at least bring it up at some point. It's just the timing. There's some clients who I know within the first one or two sessions that they would be open
Okay.
to it and that, they would benefit
Mhm.
from it. And so I bring it up pretty early on. And then they either will do it right away, or they want to focus on maybe some other piece of it first and then we work on it later. I kind of leave that up to them because I think sometimes they know themselves best and what they're ready for. But I will say, if they're like, well, I really want to focus on gaining, healthier coping skills, or process my trauma with EMDR, or, a specific technique like that, and it's not
Mm.
working, then I'll say, like, okay, we tried this. Now let's try this. And they're most of the time open to it. Um, and then there's some people where I know they are going to be, maybe more avoidant, or not necessarily like super open to it. So sometimes I build that relationship first so they trust me, because I think sometimes every client, I think, who's been in therapy, has had a mix of good and bad experiences. So, I think finding the right fit for the therapy to really, um, you know, take a flight and be successful is based on that relationship. So I'm also careful to not maybe bring things up too soon that they're not ready for, and then they kind of back away or avoid, so it's kind of a little bit of a mixed bag with how soon, I guess, I approach it with them. But I do, for the most part, bring it up to most everybody at some point in my work with
Yeah,
them.
very cool. So when you do have a client who's open to it, do you usually administer the healing that way? And if you do, is it like kind of its own separate thing, or is it part of sometimes the actual like session that you would do?
Sure. Yeah, that's a great question. With clients who I am also doing, like, talk therapy
Mhm.
with and other modalities of mental health therapy, I will do it as just like a component to their treatment, because I can then process with them, how it went and things that came up, how that might be connected to some other things that we've talked
Yeah.
about. So oftentimes I will do it in that space. Um, but I have had some clients who have sought me out, just word of mouth or whatever, and are not interested in like mental health, like talk
Okay.
therapy, but they're really into the energy work and want to, try Reiki. And so I've done that as well. And that is typically, um, yeah, it's something that sometimes I've gone to their house and done. They've come to my house, or I can also do it in my office setting
Okay.
at work, and just not have it be like the mental health, um, component like attached to it.
Okay. Well, that's awesome and amazing. Um, all right. So
Yeah.
you also mentioned you do hypnotherapy. So you're kind of a
Yes.
jack of
Yeah.
all
So I
trades.
do. Yes, absolutely. Yes, I am trained in hypnotherapy as well. Um, and that seems to also have some taboo preconceived notions, but it is, again, I think, getting better, and people are becoming more open to it. I initially got trained in hypnotherapy, probably in 2022, after my experience with Reiki. And um I guess within my work, recognizing that there are some instances where someone's negative belief system impacts them so much that talk therapy and even their openness to Reiki, it clouds them, and it blocks them, and we can't really get anywhere. And so I learned about hypnotherapy and was like, I want to try that and see if that will help with people who have so many of those guards up and parts of themselves that are trying to protect
Right.
themselves, but are then also, they're not able to meet their goals and grow in the ways that they want to because of those parts. So, yeah, I started hypnotherapy for those types of clients, and that has also grown, I think, as well, where a lot of people or clients that I have are becoming open to it, even if they're doing great and they're excelling, with some of the other techniques I do, just to have that added tool,
Mhm.
I guess. So I really like hypnotherapy because it kind of takes like that backdoor approach
Okay.
to our subconscious
Mhm.
mind, whereas with a lot of these other modalities, we kind of need their buy-in to some degree for it to work. So that's why I started doing hypnotherapy, and that's also been really successful as well in my experience.
That's awesome, and I just think too it's very telling that, like, even as one person, there are these all these different modalities that you can do to help people because even from my end of things, it's like not one thing's going to work for everybody, but then you kind of find that thing where they connect with it. And it's like, oh, okay, here we go. And it's interesting because the hypnotherapy, where you said that on a subconscious level, some people are literally just like blocking themselves. And I think that that is so true. Like, we don't even know sometimes these like certain beliefs or things that we hold onto, and it's literally blocking us from being able to live our lives. So I think that's amazing. And
Absolutely.
then just from again my end, it's like something like if I hear something like that from someone I see, it's usually a call to either do what's called a soul retrieval, and that's where I go in and help them like basically break a contract that they make with themselves like at a universal level. It's
Mm.
similar to where it's like they have these beliefs that they hold on to so hard that I have to go in and literally like break it apart for it to like not be clouding them anymore. So I just think it's so cool that there's so many different ways we can go about this and that there's so many different options for people, you know, it's like if you want to see you and do the therapy and the Reiki, you got these options. And then, or if you're like, I don't know that I need the talk therapy as much, but I need the energy work, you come see me. And that's part of what I'm trying to do with this whole thing is like build this
Mhm.
community of like, hey, whatever it is you feel you need, like you said, they know themselves best, like there are options out there and we can all just heal a little bit more and just live our life a little bit better. I That's just my 2 cents anyway.
Yeah, no, I completely agree with you. I think that that is what we all, I think at least for the most part, strive for is, to, um, yeah, be the best version of
Mhm.
ourselves. And I think in order to do that, we have to use a lot of different techniques and modalities and lean on, to each other for support too. And I think in at least in the like therapy community, we are pretty good at like, okay, well, if I can't help this client, like, who can I refer them out to? And it's the same, I think, with, Reiki and energy work too. It's like, okay, well, for example, I have some coworkers or colleagues who, are interested in that type of healing, but maybe they don't necessarily want me to do it because of, a kind of a dual relationship,
Mhm.
or they might not want me to know, some deep things because maybe it could impact our
Sure.
relationship. So then I refer out to, yeah, other energy healers and, people in the community that I know, you know are able to do the work, and I trust them. I have a good relationship, with them. So I think that's really important too, is all of us coming together as a community and kind of sharing,
Yeah.
the experience and the clients and all of those things, so that we're all able to grow in the ways that we want to and need to.
Exactly. And really just like support each other, especially from the energy work perspective of like you said, it's still like a little taboo or whatever, but if everyone can just support everybody, is like then all is well, right? So I do want to
Absolutely.
kind of ask you, so this is not to like fluff up my ego, but I am just curious because at one point you did come to me for a session. And so I'm just curious what kind of led to you doing that. Like, you obviously know you can't probably give details on the specific thing that happened, but just out of curiosity, like what made you be like, oh my God, I need to do that?
Yeah, no, that's a great question. So, I think at that time I had already started the Reiki. I don't think that I had begun the hypnotherapy part of my journey yet, but I was still really struggling with, I think, my own trauma, and I had had some I think incidents with some clients come up that were some transference, that their experience and their journey, what they were sharing, hit a chord with me and brought up my own traumas. And I also, I think at that time, had some other things personally in my life going on that just kind of, um, yeah, made everything a lot heavier too. So I remember, I had been doing the Reiki and that was helpful, but I was like, I need something more. And so I was always really interested in your
Thank
journey,
you.
doing the shaman work and the energy work and all of those things. And I was like, I'm gonna try it. I'm gonna try it and see. And it was really helpful. Um, and healing, really. I can still pretty vividly remember that experience too. And something that was notable to me was in the very beginning, like it was hard for you to access like my heart area and my heart chakra, and trying to kind of break that open, and how difficult it was for me to actually open
Okay.
it. So I think it was helpful for me as a client, um, to see how my own belief system or my own defense mechanisms can, really hold us back. So I remember you were able to like break through, and, I, from there, I had, yeah, a remarkable experience that really helped. And I think you also gave me some ideas on like crystals and like what to kind of wear, on me or
Mhm.
have in my office nearby, in my work with trauma clients and just clients in general. You never know what they're gonna bring up and
Sure.
how we hold on to it as
Yeah.
clinicians. So yeah, it was a really, really great
Well, I'm
experience.
so glad to hear that. And it's funny because I remember you because, well, you knew my sister in high school, but I do remember you. But
Yeah, yeah,
I do remember your session because, first of all, it was kind of early on in everything I was doing, and I'm always so grateful to all my clients, no matter what, but especially those few who in the beginning were like, "Yeah, let's do this," and I'm Yay, someone believes in me." But also, I just remember too asking what you do just briefly, and you told me, and I was like, oh wow, like that's interesting that she's like in the mental health profession but is open to this. And then I remember suggesting crystals to you, and you're like, oh, I already have one of the one type, I forget what I told you, and I
yeah,
was just like, oh my gosh, like
yeah,
this is amazing. Love the open-mindedness.
absolutely. Yes, yeah, absolutely. Yeah. The crystals kind of coincided with my Reiki
Mm,
work, trying to get into crystals and the different, you know, I guess healing properties that they can have. And so yeah, when you said that, I was like, "Oh, that's awesome. I already have some of
that's
those."
perfect.
So, yeah, it's really cool to be able to incorporate all of those things. And I know, yeah, I was really interested in your journey and what you were doing. And I think I always just really liked your energy, like
Oh,
your sisters too. Like you just have a energy and a presence about you, that, yeah, seems welcoming and trusting. And I think that is a huge part of all of this too, is just having the ability to connect with people on that, energy level.
Yes, and thank you. And I think that's sometimes for me what I still struggle with a little bit is I'm trying to build like from the ground up based on like trust, you know, because it can be easy. Well, I don't know about easy, but it can be easier to go out there like on social media or TikTok or something. And this is no shade to anyone who
Oh,
does
for sure.
this, but like to gain a following, right? And people who don't actually know you, who have other agendas. And it's like, I just don't want to do it that way. Like, yes, I have some social media, but like, I'm really trying to build like genuine support, not just for me, but to give out to people. So, like I said, people like you, and I'm always so grateful who are genuinely interested and who, you know, gave that leap of faith and gave me the just more confidence, I guess, to go out there and just do what I feel I'm called to be doing in this lifetime. So, um, if
Absolutely.
people wanted to get a hold of you in some way to do any or all of those things, what is the best way to go about that?
Sure. Yeah, I would say the best way to reach me would probably be through my personal email or my work email. So the work email, um, well, I guess I can give you the all of the
Yeah.
information. I work for a group practice called Becoming Free Counseling, and we are based in Rockford, but I can do telehealth therapy and also distance Reiki and energy work as well. And then, you know, um, my email for that is just Nikki at becomingfreecounseling.com. You could also just do a quick Google search and, you know, the practice comes up and all of that stuff. And then my personal email is Nikki Lynn, Lynnm 4693 at yahoo.com. So it's a little long,
Okay.
but that's another way to get a hold of me
Sure.
too. And those would be, you know, for people who really aren't, I guess, interested in the mental health
Okay.
aspect of it and just want the energy work. I think that would probably be the easiest way to get a hold of me that
Okay,
way.
perfect. And when
Mhm.
I'm able to post this and stuff, I will make sure to list those two emails as well so people can also just kind of see and go from there.
Perfect.
Well, thank you so much for your
Great. Thank
time. And
you.
I say this every time at the end, but I truly mean it that we'll have to record again. Like, have, yeah, it's
Absolutely.
so fascinating. And so, it just makes me so excited for the future when I talk to people like you and all the others I've interviewed, because it's like, we are slowly shifting, you know, consciousness, healing modalities. Like, so it's happening.
It is. It is happening. And that's what we have to remind ourselves. I know sometimes we feel like stuck or stagnant, but it is shifting. And even if it's a slow shift, it's happening. So reminding ourselves of that and surrounding ourselves um with people, you know, is a way to remind us of that as well. So yeah, thank you so much. I really appreciate all you do and your work and who you are as a person and as a
Thank
healer.
you so much. And I will talk to you soon, okay?
Awesome. Sounds good. Thank you.